The information contained on this platform represents the opinion of the host and shall not be understood, construed as, or a substitute for medical or health advice. Please see a health professional who is aware of the facts and circumstances of your individual situation.
What's good, 365ers? My name is Britt, your fit life coach, yogi, and entrepreneur, and this is the Black Health 365. It is our mission to be champions of truth and change by providing y'all with personalized healthcare information and resources from trusted professionals. We are here to empower the Black community to make healthier choices all year long. And I'm joined by my beautiful co-host.
Thank you, Britt. Jackie Page, radio personality and fitness instructor. I remembered this week. I've been forgetting the last few weeks, but I remembered. Welcome to the Black Health 365 podcast. Today we are talking about food allergies and advocacy. And joining the conversation today is public speaker, actor, and CEO, co-founder of the Elijah-Alavi Foundation, Thomas Silvera. Thomas, how are you doing today?
I'm doing well. It's been a busy day for me, but I can't complain about the progress of everything that's going on.
I hear that. Completely love to hear it. We do a thing right here on the Black Health 365 podcast. We call it check-in. So we just like to, check everybody's mental, see how everybody's doing. So I know I just asked you, how you're doing today, but overall, how are you doing?
Overall, in life, we have our challenges, our ups and downs, whether it's personal or financial or within the work ethics of life. But I'm staying afloat. I keep swimming. I'm doing a ton of things, being pretty much a one-man show in a sense. With me and my ex-wife, we run the nonprofit solely on our own. It may seem like we have tons of people running it, but it's just us two that are pretty much doing all the work. So it becomes sometimes quite cumbersome in a sense, but we're able to kind of navigate through all that process. And I'm also in school at the same time, and then we also have a kid, managing so much. So just staying afloat and staying, trying to keep a good mental headspace.
Wait, did you say on top of all of this, you're in school?
Yes, I'm actually in the process of doing my doctoral degree in public health and public policy.
Well, congratulations on that, but you got a lot going on.
Yeah.
Britt, how are you doing today? How you feeling? How's your mental?
I appreciate that, Jackie. I'm holding the fort down. Again, I like to say I'm moving in peace and maintaining a very productive space in my life. So, brother, I relate to you on wearing many hats and trying to hold the fort down. Also, in a period of my life, in a season where I'm really investing into my own well-being. Just got my teeth cleaned, setting up my doctor's appointments, going to the chiropractor, finding new coaches to help me with my breath work. I'm working all the steps right now in my life, and I'm really putting in that time and energy into me, and I'm happy about it. With that being said, I'm not trying to sound like I'm being Superman, because it's definitely ups and downs. Jackie, what's going on with you?
First and foremost, can I say I'm super proud of you, because we have talked about this. Thomas, let me tell you a little something about Britt. He is so busy to the point where he just does not want to go to the doctor whatsoever. So we have been pushing me. And the 365ers have been pushing him to take care of, himself. So it's really heartwarming to me to hear him say I'm going to the dentist, getting my doctor's appointment set up, because can I tell you, it has been a fight in two halves. It has been a fight in two halves.
I like to keep it real. I know this is Black Health 365, and we're here advocating health and being advocates for ourselves. But, being genuine, sometimes running 3 different businesses, I don't make that priority. So I am proud of myself to say that I've been making those steps, and these conversations have definitely incentivized it. What's going on with you, Jackie?
I'm happy. I'm good. I'm trying to think. Everything is pretty good. I feel like I'm at a plateau situation. I have been working out super crazy within the last week. So my body is, and we talked about this before, me doing a better job of actually listening to my body and actually doing what I need to do for myself. So I've been, teaching a lot of classes, doing a lot of workouts. So my body is saying, girl, sit down. So I'm actually going to sit down today. And I was really proud of myself. I got invited to a mixer last night, and I actually said no. I actually turned it down because I just needed the time to myself. So Yeah, I'm at like a plateau area, but really, just taking some time to really focus on like me and what I need and what I want, and actually being okay with like sitting down and saying no, and understanding that no is okay for me.
Yeah.
Definitely empowering no to others, and the power of saying no to ourselves to things that we probably shouldn't be doing. That's not in our best interests. With that being said, I'm excited for this conversation. We have a very intelligent brother here who has a very impactful nonprofit doing great things in the community. We're going to be talking about food allergies today. And it's funny because me and Jackie, we were talking the other day about this article we saw about food allergies. You want to talk about that?
Yeah, so I think I sent it to you via like CBS News and Yahoo News, but they were saying that a new study has found that food allergies are more prevalent in people of color and lower economic communities, which is a little. I'm going to be honest. It's a little alarming that is the case. You would think that food allergies would pretty much be the same across the board, no matter, what your economic status is or no matter what your race is. But to see this in 2023, I'm literally scratching my head.
Yeah. We had an episode about allergies a couple of weeks ago with a doctor. And then, the whole time I was talking about what is the mythos of allergies? Because there's so many confusing biological, I would say, conundrums about what allergies are and how they manifest in certain people. And that article just highlighted to me, wow, well, is it economic correlation? Now, is that a relationship to like food deserts? How do we get into it?
When I see these statistics and these analyticals that are put out there, it's not new for me, because I grew up in one of the most, we grew up in a very poor family, living off of, public assistance and everything, living in the most poorest areas with, our households are full of mice and roaches. And I'm an asthmatic, and I also suffer with food allergies myself. So looking at that and looking at as time has progressed, nothing has changed, but it's just now the spotlight that's being put on it. So when we had during the pandemic actually highlighted a lot of these disparities in specific communities, especially those in the Hispanic and the Black communities. So it's highlighting those because we knew COVID was the catalyst to just pinpoint everything. Because when COVID hit, then you started seeing more information regarding that these communities are not getting the health access. And we all know why, that's not happening. And then we know that certain communities don't trust specific medical, professionals due to historical, information dealing with the Tuskegee experiment, the obstetric, this with Henrietta Lacks. A lot of those things play into the fact with these communities that we can't trust that. But economical and socioeconomical factors play a big role, especially when you're poor and you live in poor conditions. That affects you. That affects so many things. And the prevalence of food allergies is on the rise because more and more people are being affected, but it's highly in the Black and Hispanic communities. Those numbers are the data that's being presented now, but I think it's a lot larger. So the numbers will be even more alarming if they were to do more in-depth research, if they were physically to go in the community. A lot of data that is mostly collected is through a data source, business or company that runs the data through certain systems. And then they present them with these statistical analysis, whether it's a qualitative or quantitative, method or whatever mixed method that they're using to prevent these findings. And, and to me, as I would say, it's not new, but the numbers are going to astronomically grow even larger. So when you look at our communities, we're going to be continually faced with these disparities because we're not getting the right access to care. When it comes to food allergies, with my son, I lived in Harlem. In Harlem, I was middle class, living in still somewhat of the rural areas in terms of socioeconomical and financial. These things are implications, especially in the schools, when you don't have schools who are very knowledgeable of certain aspects of health when it comes to Black children or Hispanic children. And we're affected by that. And with these educators, although they may say that they understand these prevalence and that they can help assist in the event of a situation was to happen with a child, But that's just, it's almost like the clickbait type situation. We'll give you the information that you want to hear so we can get the numbers for our school to keep our school moving in terms of financial stability for them. But then they drop the ball when someone fails to provide the adequate care in the event of emergency. So again, when we go back to the prevalence of it growing, the numbers are alarming because there's still factors that has not even been met. If you was to physically go to the community and having our people go to their doctors and the doctors will listen to them, opposed to providing them those short informations and answers and dismissing their care. There are so many people who have fell through the cracks with food allergies and other ailments because the doctors are not paying attention and not providing them with the right health information. So the disparities are on the rise, both with physically, mentally, financially, because I've met a parent through a community event that I did. She only carries 1 epinephrine for 4 kids who have food allergies. So now you leave your children at the most vulnerable. In the event of your children, 2 of your kids had a food allergic reaction, how would you get that 1 EpiPen? So now you have that ethical standards, like who do we save first? And the same thing goes with the schools that the children are in. So again, hopefully that kind of like, I kind of like put a little bit more in-depth information into that, but hopefully that kind of like could clarify a little bit.
That was very concise, very elaborative in the way that we wanted to hear it. I'm glad we really just dived deep into this conversation. So much of the work that you do, so much of the knowledge and the wisdom that you have gained around this topic comes from a place of your own personal story, and some trials and tribulations that you have dealt with. And I'll let you speak on that. But we're going to use that to transition, actually, talking about your advocacy work into our Dharma Talk. So for the 365ers who are familiar, our Dharma Talk is essentially, it comes from the Eastern tradition. It's a small sermon to set the tone for a conversation that's already going. But the conversation basically stems from, there's a wisdom and finding power from difficult and traumatic situations and using that to speak from a place of strength. And you find resiliency in that, and you find community and connection and empathy in that process. And, we're all dealing with things to the best of our abilities. We're all dealing with traumas to the best of our abilities. And when that process, that reframing happens within ourselves, the perception changes where we can allow ourselves to dive back into that memory and gain something from it. We can take that with us and share it into the world and really activate a power. And Thomas, that seems like it's what you are doing in your work. So I'm very interested in hearing more about it.
Yeah, no, it's one of those things. It's like, we call it, I pretty much call it like the butterfly cycle. If you look at the stages of a life cycle of a butterfly, it's like 4 stages. They start off as a caterpillar, then they go into, they have that stage of the chrysalis stage, and then they start to emerge from that, and then they start to soar. So in those processes of grief, you can either, utilize that kind of like that framework from being the caterpillar, then going to the chrysalis stage, and inside that chrysalis stage, that caterpillar and everything now breaks down into a mush, and that mush transforms them into the butterfly they are. So looking at that and looking at other aspects of how I kind of like move forward in life, it's like belief has the power to create and the power to destroy. It's us as individuals to take whichever path that we want in order to change the circumstances of our life, meaning that shift that we need. So with my wife at the time, we could have just been wallowing in our bed in our grief and just, raising our fists up into the gods and just pretty much just being angry. But, when you channel your anger into change, and you change the way you start seeing things after that. So we could have went hard at so many things. We have so many people reached out to us and wanted to do like a crazy advocacies on, in honor of our son, but we needed to do something that would be impactful and that would change circumstances. So within that time frame, knowing that this childcare did know my son had multiple food allergies, they gave him the wrong meal, which there was a prescribed one specifically for him, but they didn't give it. What hurts me the most is that they failed to tell us that they gave it to him. So when, you have these investigators in New York doing their findings, come to find out that, yeah, they did give it to him, but if you had told us originally what had happened, instead of negating what had happened, you and I would not be talking here today. And I don't talk on these platforms just to get the notoriety. It's to create the awareness that is needed. So with that being said, it just channeled, my ex-wife and I to continue doing the work and the advocacy work that we're doing today, not just by changing laws or creating laws in my son's namesake, but it's putting policies and guidance in place to protect the most vulnerable, especially in childcare and beyond. And that's one of the things, like every day I suffer, it's almost inevitable that I'm not going to be removed from the grief. It's just going to continue happening. So no matter what happens in my life, whether it's good or bad, I'm still going to suffer with that loss.
Thomas, take us back to when you found out that your son had he had a food allergy. What was that process like? And then what was that process like, explaining that to the daycare facility that he was going to?
So, I have my son Sebastian. He's 10. He has multiple food allergies. I'm a person with asthma and food allergies myself, so I'm pretty familiar with that. So understanding that my other son Sebastian had food allergies, we just become more vigilant and become advocates for our children. And even picking the right school for our child who could definitely help with that situation. It was the childcare system throughout New York State, not just New York, but in so many other places. We've had a lot of situations in childcare with both my sons where they given them the wrong thing, even though they knew they had the multiple food allergies. So when Elijah was born, he had more food allergies than my other son, Sebastian. Again, I'm pretty versed in understanding food allergies and so forth. So we kept them safe from the foods at home and to wherever we went, whether it was a family, whether it was a restaurant, whatever, we kept them safe. So when it comes to the educational system and bringing them to a childcare, we need to cross our T's and dot our I's with everything. Ask all the right questions. If there's a nurse on staff, do they understand the signs and symptoms of anaphylaxis and so forth? How do you act in the event of emergency? When those questions are asked to the school and they give you all the right answers, it gives you peace of mind. Like, yes, I have a school that will definitely take care of my children. But then, they fail. And there are so many schools that are failing our children due to that. Again, as I highlight, it's like they want these numbers. They want to say they have this so they can get the money. They can do this and do that. But you have to provide the same access of care. We as vigilant parents who have children with food allergies or any other disability, you have to provide that same access of care as you would as a parent. That is their duty as a child educator, as a teacher, and so forth. So it's, we were very vigilant and advocates for our children in any space that we were in. So, it's one of those things that's just very disheartening when you try to work so hard you want to give your child that life, and give them that protection. It's like your child shouldn't leave this earth before you. And that's what happened. So with my son Elijah having multiple food allergies, it didn't create a burden for me. It was just it's just one of those things that it was easy for us because we knew it. But when someone tells you they understand it and then in actuality they don't, it's one of those things that it can hurt or harm or destroy someone's life.
That's actually kind of scary to me. Hearing you say this is actually kind of really scary to me. So when I was in high school and most of college, I worked at a day camp and after school program. And I think one of the things that going through the CPR first aid training, one of the things that really resonated with me was, food allergies, because we had a lot of kids and being mindful of that. So to have been in that type of situation and been in that environment where I had to be very vigilant. They actually gave me a sheet of paper and I had that information about every child. And to hear that people aren't taking that serious is scary. It's scary because I'm just like, where are you missing? How are you missing that when literally, like I said, I worked at a day camp and an after school many years and we got that information. Like it's just, it's scary to hear that that is how places are operating. It really is scary.
And it's not just the childcare education system. You have from sleepaway camps to restaurants to everyone. People don't really take it serious because food allergy, although it's on the rise and it's becoming one of the largest things that's coming, is coming up. Over the years, the numbers are going to grow and grow, not just in children, but overall. So there's still those factors that not everyone believes the severity of food allergies, or you have those who have died due to that. So unless the numbers start to become alarming, to be almost epidemic-like or pandemic-like, it is a global concern, but those numbers are not that, it's not that large for them to have like the CDC or the WHO or any other medical facilities to sit up in their chairs like, we need to do something now. We know that there's no cure for food allergy. It's all about mitigating.
100%. Well, following up from that lack of knowledge, this is a preliminary question, but can we actually define some general symptoms for the 365ers of food allergies? Maybe even define the concept of anaphylaxis. I might be pronouncing that wrong.
No, anaphylaxis is correct. It's anaphylactic or anaphylaxis, depending on the state. So when it comes to someone ingesting a food particle, it can be either fully ingested, touched, smell. There's airborne allergies as well. Or, the smallest of a micron, like 0.3 microns or smaller, can be at the tip of your tongue, can create the catalyst of an anaphylactic reaction. It's like your body's response to, in the same way, it's like your body's responding to something that it doesn't recognize. So what it does is start shutting off systems. So anaphylaxis can be internal or external, where you have the hives, where you have the swelling, but it can also affect your respiratory. It can also affect your cardiovascular. It can affect your gastrointestinal. It's to the point that there is no reaction that's ever going to be the same, and every reaction should not be taken lightly. Whether it's mild, whether you don't have a reaction, it should always be treated the same. And the only line of defense to stop an anaphylaxis is epinephrine. So it's you carrying an auto-injector epinephrine to provide that first, line of care in the event of emergency. In the event that there's no epinephrine, the anaphylaxis can take over, causing you to either go into respiratory distress, go into cardiopulmonary. You have to get cardiopulmonary resuscitation involved with that. If you go into cardiac arrest as well, there's a lot of factors to that it just becomes so alarming. So the anaphylaxis is just your body not responding to those food particles and proteins. It looks at it as a foreign object, and your body system is trying to just protect it. And sometimes even with having access to epinephrine and using it the first time, it doesn't stop it entirely. You can have a second reaction, which is considered a biphasic reaction. So they always recommend you always carry 2 epinephrine at all time. And when you do have a reaction, you should immediately inject the epinephrine and call 911, and you have to go to the hospital to be monitored, because it's not just sometimes a second reaction. People can have a second reaction, a third reaction, until everything is kind of like balanced out. So
because I didn't know that you could have a second or third reaction. When you're having a second or third reaction, is it after, the EpiPen has been administered? Is it the same as the first reaction, or is it are they different?
Sometimes it's the same. It's the reaction can be just the same. It's one of those things that's scary. It's like my son Elijah. We didn't know the types of food that he was allergic to. Every time we presented him something to eat when he was a child, we gave him grapes. Immediately had a reaction. He started. And he was one that didn't really have the hives. He will have respiratory distress or something. So we would immediately give him the epinephrine. And me, I know, but sometimes on the way to the hospital, he will have his second reaction already. Even though it seemed like he's okay, that second reaction starts to build up. So you have to administer epinephrine again. That's why you have to go to the hospital in the event of such anaphylaxis happening. So, it's one of those things. It's like, make sure, like, when you're talking with your doctors, you're talking with anyone, they have to give you a very robust, in-depth information when it comes to understanding food allergies and anaphylaxis and how to administer epinephrine in the event of emergency. When it comes to the Black and Hispanic community, they don't provide that to them. So, and with our communities not understanding what anaphylaxis means, what are those body systems that are being affected, how to use epinephrine, and also people using Benadryl thinking that's the best way to help when it actually isn't. Sometimes it can mask the symptoms of your anaphylaxis happening, and then it can make you sleepy thinking that you're okay, but it can create a catalyst of impeding doom if the event you do fall asleep and you're going through that type of anaphylaxis situation. It can be quite judgmental to yourself, or it can cause you to, so much to go into that. I'm not a medical professional, just to let people know, but I've just been involved in understanding this, but as I always, you have food allergies or it's not just food allergies, but it's either bee venom or it's medication, or there's so many things that can happen that you could be allergic to. Talk to your doctors, see a specialist, and so forth.
Being an advocate that you are, and dealing with this traumatic experience that you've had in your life, and thank you so much for sharing it. I'm a single man. One day I do hope to have kids, and hearing these conversations makes me just think, dang, like, how early do I need to get my kid in the doctor? Does my kid have some issues? Like, what does that process look like? So as being an advocate, what would you recommend for newlyweds, new parents, to educate themselves?
It's, I guess it's what I can recommend is like, when it comes to, it's one of the oddest things because you cannot have food allergies or your significant other not having food allergies. And then you have a child who has multiple food allergies. It's hard to determine if your child's going to have food allergies or not. I didn't think my children were going to have food allergies, but they, happen to have that. But it's I can't really speak on that point in terms of what to do in terms of like, how do you know if your child is going to have food allergies? That's pretty much above my scope of practice. But what I can say, if in the event you do have a child and your child has food allergies, definitely seek the right help for you as a parent who doesn't understand these things by going to your primary care physician or your pediatrician, where you can seek a specialist and allergist that can actually guide you through this process and give you the right care to get access to keep your child safe, and also to give you peace of mind. Because then that changes you as a parent mentally, because it can actually affect you mentally because you're running off anxiety and fear of that one bite. And that's that one thing we all fear today. Those who have multiple food allergies or whatever it is, we're fear of that one bite because we don't know what that bite can actually kind of like entail. So it's one of those things that's like, get help, go to the right resources, because there's a lot of information out there that are not factual that will tell you, do this, take this supplement, take these drops to actually help cure your food allergies. There's no known cure for food allergies. It's all about prevention and mitigation. That's it. So in being an advocate, if you do have a child, it's just seek the right professional help, whether pediatrician, your primary care physician, and an allergist, especially in your community.
You said earlier that you deal with allergies. So when you had your sons, did you actually go take them to go see an allergist because you had allergies?
Well, like me for myself, but it's kind of imperative for them, especially having multiple food allergies. We don't want them, like whatever allergies we are known that they have, there's a possibility they can have other allergens that we're unaware of. So taking them to an allergist and them testing them, there are different methods of them testing for allergies, for whether it's like food or like specific proteins and so forth. They do the testing at their facilities. So it was one of those things that was important to get that done, so we can see what allergies are the most like their anaphylaxis to, because there are some that come up that is very mild, but I look at the most mild to take it as serious anyway. I don't want them to ingest something that they really don't have an allergic reaction to, then later on they do have that reaction to. So it's always just keeping them safe and then, being vigilant.
Yeah, it definitely makes a lot of sense. I think that's a good, like, what's your 365 is parents, if you do have allergies, that's something, like you said, being vigilant, making sure that you keep your child safe, just being aware of that type of stuff, because, you have it, your child may have it. So being vigilant, being aware. I think that's a great, midpoint 365. Also wanted to ask you about Elijah's Law. What is that?
So Elijah's Law is, it's named after my beloved son, Elijah-Alavi. It was one of the things that my ex-wife and we worked on in New York, to basically put guidance and protection in place in childcare centers, because New York did not have anything for childcare. They were only a voluntary guideline that governed K through 12, but just what I said, voluntary guidelines for schools to kind of like adapt, just to keep children safe. But the childcare in New York State didn't really have anything. So my ex-wife and we worked on writing the guidance and writing the policies and putting it in place, and working with the elected officials at the time was Senator Brian Benjamin and Assemblyman Al Taylor, working with our district leader, Cordell Clare, on these matters and making sure we can put something in place that will be solid and ironclad. So when it does go through the legislative process, that there won't be any oppositions that will hold the bill back. So when we got the unanimous votes for this bill to continue pass through, and it's signed by the governor at the time, by Cuomo, it was one of the things that has never been done in New York State. And then it was one of the first of its kind in the United States to actually happen on a mandated law, specifically for licensed and registered daycare centers throughout New York State. So Elijah's Law, it sounds simple, but there are so many childcare centers throughout this country that doesn't have basically say all his eggs in his baskets in a sense. There are still missing pieces. So what we do, we've actually created a toolkit with AAFA, which is Asthma and Allergy Foundation of America. We created a toolkit with them that breaks down every state in this country on their guidance and policies for their childcare centers. So what we do with Elijah's Law, we go to those states and we go in and we close those gaps. And those gaps are being closed. So in the event that they're missing epinephrine training or access to epinephrine and so forth, we go in there, we work with Elijah's Law within that state, and we close that. So we're currently working. We just got a city ordinance passed for Kansas City. We're working on Missouri. We have a bill in Pennsylvania. We're working in a bill for Michigan. We're working in a bill for California. So our goal is not just to get it, state by state, but make it into a federal legislation. Elijah's Law is one of those bills that we want, not just for our namesake and the legacy of our son, but it keeps children safe and give parents, and I keep stressing, it gives parents peace of mind when they go to their child care centers, because they have this tangible information when the law is passed to bring to these schools to provide the help.
I think it's interesting that, one, this hasn't already been or wasn't already a thing, but then two, hearing you say that you're working with other states to really push this forward. This isn't a federal situation in 2023. You would think it would be. Is this not something that's just like, nationwide? Am I missing something right now?
No, unfortunately not. It's we wish it was nationwide. That's one of the goals for us, is to make this into a federal legislation, because it's one of the importance of making sure we can close that gap throughout every state. Unfortunately, it's not. That's why we're working so diligently to make it happen. And it's baffling, right? It's baffling to see it not even happening, but that's why through the work that we're doing via our foundation and working with so many organizations and advocacy groups, just to create those things in every state.
It's powerful to see what you and your ex-wife have done, and now pushing this national platform for what is needed. What can people do who, on a small level, how can people be advocates in their communities?
I think, as advocates, it's like advocacy is a space that is, I see it as not an option, but a necessity. You can initiate change right in your homes, in your school, in your community, from educating those around you to pushing to similar protective and legislations like Elijah's Law in their own state. And with every effort, they have the potential to reshape the landscape of food allergy care in these schools. So it's them, if I was to propose something, we have this amazing, literally the blueprint for you to advocate in your own in your own state, which is going to the Elijah-Alavi Foundation.org's website and click on Elijah's Law. You can find a blueprint right there, or go to AAFA.org/Elijah's Law. Will actually give you all the information is how to call your legislators, how to advocate in your schools or your community, and get Elijah's Law in their state. And you cannot, it couldn't be just for Elijah's Law. It could be for any law that will put protection for a child when it comes to food allergies.
What can parents and kids do as they're entering into schools to make sure that they're being advocates for themselves? Because I think that's one of the things that we miss out a lot on, is being an advocate for ourselves. So how can a child and a parent go into a school and say, hey, you know what, my child has a food allergy, or I have a food allergy, and you need to pay attention to this?
This will be a What's Your 365 for the listeners.
So as my ex-wife, she puts very clearly, and she's done it very so diligently, and I love her for doing that, is that she's like, make sure your presence is known even when you're not in the room. So when it comes to your child having food allergies or any ailment that is, you are the advocate. You are the vigilant person to making sure that you are talking to every single person in that school, whether it's from the teacher, the principal, the parent coordinator, the lunchroom staff, and so forth, and educating them on the severity of food allergies and the information of, you know, what your child is dealing with. You know, we want to make sure that every person knows about this. So when you walk into the school and when you leave from the school, that they understand what's going on. So it just keeps your child safe, and everyone will be vigilant themselves and advocating for your child while they're there as well.
Thomas, that was really, really great information. And like Britt said, I think that was a really good, you know, what's your 365? You know, you got to be an advocate. You got to make sure that everybody is intertwined and everybody is connected and everybody knows what's going on. So thank you for sharing that. You mentioned earlier some of the resources that people can tap into, including your foundation. Can you one more time kind of go over some of the resources that the 365ers can tap into when it comes to food allergies and getting more awareness and bringing more advocacy to this?
Yeah, if you want to find out more about food allergies and advocacy and awareness, you can go to the Elijah-Alavi Foundation.org. We have a bevy of information on there. It gives you up-to-date information on what we're doing and what are the next steps of how we're doing things. And if you want to create legislations like Elijah's Law in your state, you can go to the Elijah-Alavi Foundation.org or go to AAFA.org/Elijah's Law. It gives you the blueprint and how to create change, impactful change in your state.
Absolutely love it. Thomas, if people want to reach out to you directly, social media or the website, where can they do that at?
They can reach us on Instagram at Elijah's Echo, or Facebook at Elijah-Alavi Foundation, and or through the foundation's website. Send me an email through there, and I do kind of respond and make sure I don't have so much going on. I try to respond as much as I can to everyone.
That's amazing. Brother, I can't thank you enough for the pivotal work you've been doing in the community. Thank you for sharing your story. I'm sure there's so much to be grown from the work that you and your ex-wife are doing. You know, going back to the Dharma talk earlier, we can find so much power and strength from our pain. And you've done that deep work. I can't thank you enough.
Yeah, I appreciate that, man. And, you know, it's all, like I said, you know, we have believed, you know, you have the power to either create change for yourself. You have that. Beliefs have the power to create or the power to change. However you want to do that, it's like you got to really hone in on what is that and utilize it, whether it's good or bad. But, you know, sometimes we went the more light approach of creating lasting impactful change.
100%. This is the Black Health 365. Jackie, you want to close this thing on out?
Yes. 365ers, if you have something you want us to talk about or cover, hit us up on Instagram at Black Health 365. Again, that is Black Health 365. Slide in those DMs, get at us. We'll make sure that we are advocate for you, because when we're an advocate for you, we're an advocate for ourselves and the Black community. Again, I'm Jackie Page. You can find me on Instagram at Love Jackie Page.
And my name is Britt. You can find me at profitfitness.life. Again, 365ers, is your responsibility to be an advocate for your health. Know your needs and make them known. Peace, namaste, and love.
Bye, guys. Thank you guys for having me.